Hello and good morning, everyone. Good morning, good afternoon. I hope everyone can hear us okay, see us okay. Please do let us know on the comments box. Right, I'm not seeing anything coming in on the chat, but I'm going to take it as a yes. Wonderful. That being said, good morning, everyone, to my all our audiences who are on the West Coast, and good afternoon to everyone who is in the East Coast. I'm Arun, your host today. I'm thrilled to be your host, and this is the second episode of our ongoing academic series here at QuestionPro. So I'm kind of to give you a little bit of introduction about me. Give me just Hi, like I said, you can see my name and my intro on screen. But before that, I'll also let you know that I'm kind of deeply passionate about our academic research, right? Because it connects me with the brilliant minds which you are who are shaping our future, right? Every innovation in our world is driven by insights of scholars like you, and it's incredibly fulfilling for me to be able to help facilitate that research in any way I can, be that maybe very little, but ultimately it's all about creating a better tomorrow. So, and outside of work, I'm also an kind of an avid motorcycle tourer, right? Be it solo ride or going out with a group. There is a unique sense of calm, right? When you hit that road, and I truly believe that riding kind of teaches me the important lessons in endurance, teamwork, and respect for the diverse culture we encounter along the way. And the journey, as they say, is just important as the destination itself. So I'm excited to dive into today's topic, navigating the IRB process with QuestionPro, which is also a guide for researchers. Now, this is the second episode of our ongoing academic series. And if you have missed our first session, The Future of Academic Research, Integrating AI and BI with QuestionPro, that webinar is available for your viewing on our QuestionPro YouTube channel. So we highly encourage you to check it out if you haven't already. Okay. And for those of who, if you cannot stay for the entire session today or would like to revisit our conversation today, the recording of this webinar will also be available on QuestionPro YouTube channel shortly after we finish. So feel free to check back anytime. Once again, thank you all for being here with us today. We are excited to dive into the nuances of navigating the IRB process. And I know this discussion will be incredibly beneficial for all the researchers at all the levels, right? Now, that being said, today we will quickly dive into the introduction of IRB and compliance, the common challenges in the IRB process. Then we will also discuss about practical tips and the best practices. And afterwards, we will do a Q&A session, right? Now, that being said, I would also like to introduce our beautiful and wonderful guest today. Is someone truly remarkable in the field of research and compliance, Dr. Mahesh Pillai. Dr. Pillai is the Director of Research Compliance at the University of Toledo, where he oversees several key committees, including the Institutional Review Board, Institutional Animal Care and Use Committee, and more. He's also a voting member on multiple compliance, ensuring research at his institution meets the highest standards. Dr. Pillai brings, kind of not only just clinical and research expertise, and his research interests include obesity medicine and research compliance, topics that are so vital to today's conversation. His ability to build and lead cross-functional teams is a testament to his leadership and vision in research compliance. Mahesh, we are truly lucky to have you here with us today, and I know you will all gain valuable insights from his experience. Now, that being said, without further ado, Dr. Mahesh Pillai, the mic is yours.
Okay. Hello, everyone. Thank you, Arun, for the kind introduction. I'm excited to be here. Thank you to QuestionPro for this platform where I get to talk about research compliance and research. And as Arun mentioned, I'm really passionate about not just the research compliance aspect, but I have been on the other side, right? As you say, I've been an avid researcher, and I am a researcher because I think once you're a researcher, you can't get that thing out of you, right? So, my primary aim here is to instill the fear of IRB in you guys. Just kidding. Okay. It's the other way around, right? I think when you're on the other side, when you're a researcher, it's like you consider IRB or any other compliance area as a barrier to research. And that's not really true. But I think to understand why you feel that way or why researchers feel that way on what the other side, the compliance, does, that's the aim of this discussion. And also to help you like write better protocols, get your approvals done sooner, faster, right? That's all we want as researchers. I always compare researchers. When I say researchers, I mean including me as like with people with blinders on, right? Like we have a very soul concentrated focus on what we want to achieve, and we don't want to look anywhere else. Um, so if you can go to the next slide. So the way I want to talk about this is I want to talk about history of research ethics and history of human subjects research because it's important to know that, right? So the talk is going to go back and forth between history and also understanding why we talk about certain topics, why we ask about certain things in the IRB process. Just to start with the basics, what is an IRB, right? So IRB is responsible of protection of rights and safety of research participants. Okay. Now, when you think of IRB, I want you to think of two aspects. It's human subjects research, right? Institutional Review Board governs human subjects research. And human subjects research can be broken into two parts. There's a human subjects component to it, and there's a research component to it. So both these definitions have to be met. Okay. Now I'll let you Google and search the exact definitions. I'm just going to give you like a summary. So human subjects is either about a person, right? Information or interaction um, or intervention with a human being or data, right? So even if you access like patient records, it's about a human being, right? So that's considered human subjects. And research is everything else, right? Like research is where you have a specific questions, you have a specific goal, you have a specific objective, right? And your questions and your methodology is based on achieving that goal, right? So as long as both these definitions are met, you would fall in that human subjects research component, and that means you would fall under the IRB purview, right? Now, why is IRB necessary, right? Like why do we need an IRB? So historically, right, like when you take a step back and you think of I don't know how we can do interaction here, but think of World War II, right? Like, I don't know how many of you have heard of the Nuremberg trials, the trials where physicians or clinicians who were doing experimentation on humans without their consent, right? They were putting them in freezing conditions, trying to revive them from the cold, trying to see how many would survive, right? All those inhumane experimentation that was going on, and again without their consent. They didn't know what was going on, did not agree to that, right? And all of those things that happened, Nuremberg trials were trials that were done post World War II, where all these people were brought to justice, right? And if the a common theme of the talk is going to be about like consent, right? Like why is it important to provide consent? What does it consent really mean, right? So that's one example. Even in here in the US, so this was Germany, right? But even here in the US, if you have heard of the Tuskegee syphilis study, where which was conducted by the US Public Health Service, where they were studying untreated syphilis in mainly African American men, right? So they were not in those cases. Again, there was no consent involved, right, or very little consent. They were just told that they are studying a disease of bad blood, but they didn't know exactly what they were studying, right? Like the participants didn't know what they were studying. They were given all kinds of perks like free meals, insurance, rights to the center, and all those kind of things. Which, if you think of like 1932 to 1972, and think of the condition of African American men, right? So all those could be considered what is now coercing, right? Coercion or undue influence kind of behavior. So all those things like added up, right? And even when treatment was available for syphilis, none of these people were offered that treatment, right? So you can think of like all the kind of injustice in this whole situation. Again, like once it was discovered, they shut the study down. And um, over the years since the Nuremberg trials, there have been different agencies that have tried to have some kind of compliance built in to this whole research with human subjects. So if you go back to Declaration of Helsinki, which is the World Medical Association came out and said informed consent is required before participation. There has to be some preclinical studies before using human subjects in research. In the US, anytime you read about regulations in the US, you're going to come across this Belmont report, right? And so 1979, after the Tuskegee study, there was a panel that was put together which created the Belmont report, which talks about three major things, right? So you will first is respect for persons, right? Like what does respect for persons mean? Respect for person means you are respecting the other person's choice, right? You're allowing the individual to choose participation, right? So like for treatment, like you go to a doctor, right? Like you're asked like, can I give you this medication because this is what we think, and then you have to agree, right? You are given a choice and you are like signing a consent to be seen at an institution. Similarly, respect for persons is choosing participation for a study, for a human subjects research study. Second, you will hear is beneficence. Beneficence means maximize benefits and minimize risk. Do no harm. So, if any of you have heard about the Hippocratic Oath that clinicians, physicians, anyone dealing with patients takes, that's that do no harm, right? So, maximize benefits but minimize risk. So, that's one of the things you'll always see is the IRB asking, how are you going to? IRB is looking at the risk benefit ratio, right? Like, are the risks reasonable? Are the benefits reasonable in relation to the risks? That's what the IRB is looking at. And the third important part is justice, where no group should bear the risk where the benefits apply broadly, right? For example, you're looking at healthy males in the age of 18 to 50, right? And that research can be applied broadly across the society. You cannot target just prisoners because they're in an institution. It's easier to access them, right? So we're looking at like how you're getting a representative population, right? But you're also not putting a certain population at increased risk just because it's convenient for you, right? So those are some of the things that we're going to talk about, right? Now, going back to what is an IRB, right? So IRB is that independent ethics board in your institution that is responsible as per federal regulations, state regulations, right? In university policies and procedures, it's a body composed of different people in like faculty or staff kind of roles who have a very good understanding of research, but also are trained to understand the human subject protections aspect, right? So there's an IRB, and in most institutions you will find that there is a supporting office like our office does, right? Research compliance, where we are supporting the IRB, providing subject matter expertise on these issues. And sorry, I forgot to mention this in the beginning, but if you have any questions, feel free to put it in the chat or like just shout out, and I'll be happy to talk about it as we go along. Arun, if you could please go to the next slide. So we talked about a few of these things, right? IRB requirements. So we talked about informed consent, right? So what do we mean by informed consent? Like, I think the the understanding in general is like, okay, informed consent is we have all the information on a page or 20 pages, and you hand it over to the participant, and the participant just signs it. Yes, that's a way of documenting informed consent, but that's not informed consent. When we talk about informed consent, you want to talk about the informed consent process, right? And what that process includes is making sure that your informed consent form is written at a level that can be understood by the participants, right? So whenever we talk about informed consent on the compliance side, we are like, it has to be at an 8th grade reading level, right? Now, when you hand it over to the participant, you cannot expect them to be done reading and informed consent and understand in like 20 minutes for a 20-page document, right? You have to give them enough time to read the document, right? Try to understand the document, be able to ask you questions. If they don't feel comfortable signing the document, they should be given an opportunity to take it back home or discuss it with anyone they want to discuss it, and then come back when they're satisfied. Then they can sign the consent, right? That's how you're documenting consent, right? So that's the informed consent form. And I think I have a question, 45 CFR 46, right? So 45 CFR 46 is the federal regulation. So if you remember the Belmont report, right? So the Department of Health and Human Services used that Belmont report and created their own set of regulations. Now, over the years, many of the federal agencies signed on to that, and it became what is called as the common rule. Okay. Now, a few years ago, 2021, is when that rule was amended, and now it's 2019. Now the rule is called the revised common rule. Okay. Now the revised common rule is applicable to all agencies except the FDA, Food and Drug Administration. They have their own set of rules, which are very similar but different, because if you think of FDA, it is mainly drugs and devices, right? So those rules have to be modified for FDA purposes. And those are the regulations that govern IRB, right? So IRB is not like something that the institution decides, oh, we need to have an IRB. Federal regulations require institutions to have an IRB. Okay. And I hope that answered your question, Harshad. Coming back to this understanding IRB requirements, informed consent, right? We talked about informed consent being a process and not just a document. Risk benefit analysis, right? We are looking at what are the potential benefits, right? Like, are the risks, are the benefits reasonable in relationship to the risk? Like, are you putting somebody in extreme risk to get like very little benefit, right? And when you talk about benefits, I want you to broaden your thinking of the benefits do not always have to be to the person, right? The benefits can be larger and apply broader to the society or many people, like in having the same condition or disease, right? So many a times you cannot promise benefit for an experimental drug or a device, right? But you can justify it by saying that it applies to a broader community. It's going to further knowledge for that treatment or for that condition, right? So that's the risk benefit analysis and how IRB is looking at it. The other part is data confidentiality, right? Like, what do we mean by data confidentiality? Any data that you obtain from a participant has to be confidential. It's on a need to know basis, right? So only the people associated with the study are supposed to know that information, right? So even like the drug studies, like the names and all the identifiable information is typically not transmitted to the directly to the companies, or there is some sort of a mechanism in place for protection of the rights and safety and privacy of the participants, right? So these are some of the like typical kind of things that you see, and all these things have to be very clearly mentioned in the consent, right? It's so that first part, informed consent, everything has to be clearly mentioned, like how much time is this going to take, what is my benefit, what is my risk, right? what happens to my data, who can access my data, what happens if I am injured during the study, right? Like, will I get compensation? Am I being compensated for being part of the study, right? So all these are important considerations. I want you to think of, like, when you look at it as a participant, is this enough information to tell me whether I want to participate or not, right? So it's important for you to, I think, take a step back as researchers and look at it from the participant side, right? And be able to objectively look at a consent or a process and say whether it is going to work for you or not. I think I've shared a lot of information, so we'll take a break here. And Arun, if you want to go to the next slide.
Yes. Now, the next slide is actually, Mahesh, this is one of our questions, right? We have come so far on a technology standpoint, right? Now, even though AI has been introduced to the world way earlier than what we know as of ChatGPT's emergence, right? But AI has been since there from the 1950s itself. So, what here my question is, how technology as a factor has impacted the IRB's work? If you could shed some light.
No, that is a great question. So I would say immensely. So I remember when I started here at the University of Toledo, we did have an application management system. So when I say application management system, the system where you could electronically submit your IRB application, it would be reviewed electronically. It was not a completely independent system because there was still some paperwork involved, backend things we were trying to save on, like local drives and all those kind of things. And a little before that, it was all paper. So when I came into this role, there was a bunch of stuff, bunch of studies that was still paper. Some of it was electronic, but then even the electronic stuff, we had to maintain like paper records of a bunch of them. And then after I moved into the role, within some time, we got like a completely electronic system. Now, it's good. It's extremely good to have an electronic management system, application management system, because now you can do everything in that system, right? People are submitting their applications. Our office is doing what's called a pre-review, right? So if people on this call don't understand that aspect, what happens typically in an IRB office is when you make a submission, when you submit something for review, it's looked at by the support staff, a compliance office, right? The compliance office is looking at it from the entire application, right? They're looking at if the whole thing makes sense. Are protections in place? Is your consent appropriate? Are you targeting the right population? Is your training complete? Do you have you submitted conflict of interest forms, right? And 99% of the times, we're going to talk about these problems, but 99% of the times, it's going to go back. I would say 99.5 or more, right? So don't take it as something wrong that you did, right? Because you're probably submitting this the first time. But when we look at it, there are many more things that we are looking at, right? So, so that's the pre-review process. And once it's in a good enough shape, that's when it's sent to the IRB and the members for review. Okay. So this whole process that I mentioned right now, this whole process can now be done within that application management system now. Okay. And also, like, we can set up meetings, we can have an agenda in there, we can have things that are going to the meeting, everything in there. It creates minutes. We still have to modify the minutes, but it's still a much better system than what we were doing. It also lets you like stamp documents, so like an approval date, an expiration date, things we were doing manually, right? So think of a 20-page consent that you're manually stamping on the right lower corner, an approval date and an expiration date. Yeah.
Mahesh, we
And
also have
yeah,
one more question. This is coming from Malvika. What about the use of research technology? Has that affected the IRB team?
so what do we mean by research technology? Is
Malvika, if you would like to, when you mentioned what about the use of research technology, Mahesh would like to know what kind of research technology you're referring to. If you could, yeah, more like a survey platform itself, like QuestionPro.
Yeah, so we've had researchers use survey platforms in the past, right? I think with every survey platform, it's about the IRB has a learning curve, right? Like, so whenever we have a new survey platform, what we're trying to do is we are trying to look at what kind of protections are in place, right? Like, some research is collecting really sensitive data, right? Something, if it's released out to the public, right, with the identifiers involved, can cause harm to the participants. Now, harm is not just physical harm, right? It could be economical harm, it could be harm to the reputation of the individual or the institution, right? So those are some of this, or psychological harm, right? So you're looking at all these aspects, and as an IRB, it's important for an IRB to understand what kind of research is this, right? What kind of protections need to be in place? Is the survey platform that is being used appropriate for that kind of research? Um, and I think, as any other field, right, IRB and research platforms and research technology are constantly evolving. So the kind of research that we see on a day-to-day basis, and which makes our life like very interesting, is we get to be um, at that edge of cutting edge technology, cutting edge research platforms, cutting edge research, drugs, devices, interventions. We get to look at all those things as we review these applications. And I think a big role of the IRB is also education, right? Education of researchers, right? Education of students. And our group is like very deeply involved in this. Like, we offer educational opportunities to researchers, students, graduate students, undergraduate students, and anyone actually who approaches us. I hope that answered your question, Malvika.
Yes, that does, Mahesh. Thank you so much. Now, we would also love to know about the common IRB process challenges.
Yeah. So yeah, challenges faced by our researchers, right? Like, uh, I think the number one thing people want is, I want my research approved yesterday, right? Uh, and again, like, I want to be really clear when I'm talking about this, I'm talking about it as a researcher as well, right? So I've been on both sides. I am on both sides. And I want you to understand this aspect, right? Like, I remember when I used to be submitting my applications to compliance teams and compliance committees, and I was like, why is this taking so long? Like, why are they asking me these questions? But now on this side, I'm like, okay, now I know why are they asking these questions. One of the common complaints we get is long approval times. Okay, now I want you to think of the approval process that I mentioned a few minutes ago, right? You submit the application. There's a pre-review process. 99.5% times it goes back, right? And I think that's where it takes the most time, right? Once that pre-review is done, if it's returned back to you, the expectation is for it to be submitted in a certain amount of time, right? If that there's a long duration between resubmitting something, right, that's going to add to your processing time, right? If you're not sure of what the person is asking, right? Like, so sometimes we lose that touch, right? Like, I ask a question in an application, it doesn't make sense to you. You just send it back saying, "Oh, I don't understand what you're asking," and this back and forth takes time. So Christy says here it took 4 times, revised 4 times, right? There's a complex steps in reviewing and resubmitting. I would say try to connect with somebody in your IRB office, right? That helps. And what we do, like at our institution at University of Toledo, is we try to be available to researchers. And if somebody reaches out and says, I don't understand what you really want me to do here, okay, let's set up a time, let's talk about your questions, and let's like try to get the best response in, right? Because I also want you to think of, let's say our staff doesn't do the job and is doesn't look at everything. The first time you submit, they just send it to the reviewer. Now we are wasting the time of a reviewer who is a voluntary person who has faculty responsibilities or staff responsibilities. They are just volunteering on this committee. We're wasting that their time. They're going to send the same things back to you, and then you're going to go through the same process. So it really doesn't help, right? So and we understand, right? Students are on a short turnaround time. They want to get things done really quickly. And yes, that's when you pick up the phone or you send an email and set up a time with your um, HRPP staff and try to address these things, right? So all those things are like really, really important. Complex documentation, right? Now, when we say complex documentation, it's also sometimes I think not understanding all the steps. And the reason for not understanding is because you don't live in that world of compliance, right? So sometimes it's like, okay, I'm going to obtain samples or I'm going to obtain data from nursing home X, right? But then clearly in the IRB application, there is a line that says if you're doing research outside the institution, you have to obtain a permission letter, right? Now, if that permission letter is not there, like there is no way we can go to the next step and go to the review phase, right? So that permission letter is required. Many times IRBs like provide like a template copy, which you take to the administrator, the other institution, and like fill it out. Again, these are questions you can like very easily talk to somebody in your group. Now, many institutions, they are IRBs or they are compliance staff offer these training sessions, right? Like I remember going to this class where all they are doing is research, right? And they wanted me to come in and like talk to the students, right? We all sat down in a round table and we kind of discussed. Each student brought up their project, and I was like, oh, maybe this is what you should do, maybe this is what you should do. So see if there is an avenue to do that, right? Or if there is somebody like who's really experienced in your department or in your cohort that has gone through the IRB process. Sometimes that helps. And again, a lot of these are either like required federally or like there are institutional policies or procedures that require them. Compliance issues with multi-department studies. As you all know, right, the more people we involve, the more complicated things get, right? It's very important that there is one representative in these multi-departmental studies who can communicate effectively with an IRB, right? Because just I want you to think of a scenario, right? There are 5 people in a room, right? In these multi-department studies, and there's one HRPP staff person who's sitting, human research protection program staff person sitting and trying to understand, and then you get 5 different versions or 5 different things that each of the department is doing, right? It's important to have that cohesive nature, right? Like being able to explain things in a way that is very easily understood. Now, I also want you to think of the IRB members. The person who's reviewing your application is not going to be an expert in your research, right? You need to be able to very clearly and in plain language explain to somebody, right, that this is what you're trying to do, right? And I'll give you a personal example is like whenever I try to explain a concept to someone, I tried to like start from the very basics and then try to build up, right? Like the really complex nature of your work, right? Like so, say I'm going to be using these enzymes to analyze from these samples that I'm using because research has shown this and this, right? Now to go to the pathway level of the breakdown, that's too scientific, complicated. Should you be mentioning that in the application? Yes, but there is usually a section in your application which says objectives and backgrounds, provide a lay description, That's where you want to provide that lay description, right? Multi-department studies are always going to be complicated, but there is a way to achieve it. Like, we have looked at multi-department studies and we have tried to help them out and sort things out. So it is definitely possible. It's definitely challenging, but it's definitely possible. And again, this is a lot of it is based on my experience with like research and working with multiple departments and trying to figure out. Um, yeah, I'm sure y'all are going to have these kind of issues, and communication is key, right? Coming to the same page is key. Being able to explain your research is key, right? And if many of you are undergraduates or graduate students on this call, you have all these 3-minute challenges, right? 3-minute, 5-minute challenges that your departments or conferences are going to subject you to, where you're going to explain in 3 minutes or 5 minutes your research, right? And as scientists, that is one of the most important things we should be able to do: communicate science in a very clear and concise manner. So that's from my experience. And have any of you faced any other challenges that you would like to talk about in the chat? Something you think the group would benefit or we can talk about?
Yes. So meanwhile, we wait for our audiences to share their experiences. Mahesh, I have one question. I'm going to put it on the screen as well. Right now, the main reason I want to ask what are the common mistake researchers make with the IRB application is because this has happened to a lot of students and researchers we work with who come to QuestionPro for to get their audience panel from QuestionPro, right? They had several instances where in their IRB process they got stuck, and because of some kind of mistakes, their applications were rejected, and then they had to redo it all over again, right? So, which is why we wanted to ask, what are the common mistakes that researchers actually make, which with the IRB applications?
Yeah, so I think a lot of things that we have seen are not understanding the question, right, that the IRB application is asking about, right? And to give you an example, like initially I mentioned, right, like patient data. And when we are talking about patient data, one of the responses we have received is, oh, this does not involve patients or does not involve human subjects, participants, because all we're doing is data, right? But understanding that data is considered, meets the definition of human subjects, right, as per regulations. One of them, like one of the things is that. The other part is like the consent process and the recruitment process not having enough clarity, right? So again, let's take a step back and think of like how you want to lay it out as you were explaining to your friend, right? Your friend who doesn't have any, maybe has science background but is not related to your study. Will it make sense for them, right? Will it make sense for them as how you're trying to recruit? Okay, I'm going to put on flyers in the community, right? But the IRB wants to know like where, right? Like, it's when you say community, what do you really mean by community? Are you putting it in community centers? Are you going to put it in the library? Are you going to put it in a clinic? Because think of it in a way that, what do you require to put in a clinic, right? Do you need permission from that clinic? Do you need permission from the library to put it up there, right? So those are the things you want to like think about. Like, I want you to think of like really basic terms, right? um, and I think providing like um, documents, like not providing all the required information. So if you say flyer and then you say an email script, right, and then you say you're going to go into the classroom and have announce about this research, right? Now we're talking about 3 documents, right? You're talking about a flyer, right? So we need a flyer. The IRB needs to see a flyer, right? IRB needs to see any email script that you have, right? And then IRB also needs to see a verbal script, right? So it can't be like, I'm just going to go and talk about my research. It has to be like very specific verbal script, right? Because when you talk about in a classroom setting, for example, when you go into a classroom setting and say, I'm going to talk about my research, and you have to be really clear, right? This is voluntary. That's one of the most important aspects of research, is it has to be voluntary, human subjects research, right? Is this going to, and clearly in the classroom you're saying this is not going to affect your grades, right? It's not going to affect your relationship in this course, right? All those things need to be really clear. So that's why IRB wants to actually um, see that in writing, right? IRB is going to hold you to what you have put in a protocol, right? And sometimes there are mismatches, right? There's an IRB application which says something else, and there is a protocol usually attached which is not exactly the same. For example, let's say I'm going to look at patient records from 1/1/2020 to 1/1/2024. That's in the IRB application. And in the protocol narrative, it says 1/1/2021 to 1/1/2025. Now you have like a 1 year gap, right? You don't want that, right? You want to be consistent. And again, like these are things that happen, right? Like uh, you really can't pinpoint. Yes, these are errors that should not happen, but things happen, right? Like, so it's important to like realize that and try to like change, like rectify the mistakes, and like try to provide like a clean copy of your application. So I have a question here that talks about generalizability, right? I think if we start talking about generalizable knowledge, we are probably going to be here for a few days. So when we talk about generalizability, right? Like there is various ways generalizability is applied, right? The way some of the institutions do or look at generalizability is like very simple, right? In terms of, is this going to be published? Is this going to be shared information? Is this going to add to the um, contribute to the knowledge or create knowledge in that group? So this is like a very gray area, and it is up to the researchers to provide information to say that this is not generalizable information, right? And prove that this does not then meet the definition of research, because one of the main components of that research definition is this going to be generalizable knowledge, right? Is this going to create or contribute to the field of knowledge? Okay, um, so you have to like work with your IRB group and help them understand, right, how this is not generalizable information. There's no single answer to this question.
Absolutely. Now, thank you so much for that valuable insight, Mahesh. Now, what we would really love to understand is the tips and the best practices for IRB success.
Yeah, so some of these things we've already gone through in this presentation, but preparation tips, as it says, right? Start early with the IRB submission process, right? You don't want to wait till the semester you have to defend to submit an IRB proposal, right? And the reason I'm saying this is because we have seen that, right? You want to um, start as soon as possible, try to find a contact, right, with the IRB, develop like a good working relationship with them, because I will tell you, people go out of their way to help if you have a good working relationship with someone, right? And you want to have it as a cordial relationship, right? Because you want to get your IRB project through, right? The IRB staff is trying to do the same. They want to get your things approved, right? They don't want to delay. The goal of HRPP staff is not to delay your research, not to be a barrier for research, right? It's a collective institutional responsibility to foster research at any institution. So I want you to be like very aware of this, right? Um, Align your research objectives with ethical standards. Does that mean that you need to know everything about like the Belmont report and like HHS 45 CFR 46 or 21 CFR 50 and 56. No, that's not the expectation, right? Um, we are the subject matter experts on that, right? But if you reach out to us, we will. If you really want to learn, we'll explain that to you. But if you don't and you want to just stick to getting your things approved, we will tell you what would be the best way to do that, right? And that's the responsibility of the IRB staff and IRB in general. Okay. Um, the second part is submission tips, right? Um, as it says here, ensure all your documents are thorough and carefree. That's easier said than done, right? Uh, but you want to take a look at it very objectively, right? One of the things that we see missing is guidance from your mentor, right, or from your PI. You want to make sure that you have taken the time to discuss with your mentor that this is exactly what you want, right? You guys have to be on the same page, right? So that there's no errors and you don't have to go back and forth. In the application management system that we use, what happens is, let's say as a student or a researcher, you're submitting it, it goes to a secondary phase of signature from the PI, right? And the PI has to sign off on it, right? So you want to make sure that you and the PI are on the um, same page on that. Um, Double check for compliance with institutional policies. Again, I think it's what I've heard from researchers is like, oh my God, there are so many policies, there's so many procedures. I have no idea what it means and why I'm doing certain things, right? Um, Try to like understand the basic or try to look at the policies. If many times, right, like when IRB applications are very clear, like none of them ask you about like, do you know this policy? It's not a trap, right? We are not trying to make sure that you understand a policy, but we are trying to apply those policies, right? We are going to apply those policies. So you want to submit the information, and if the IRB comes back and says, no, this does not align to the policy, and like this is what you should be doing, right? Sometimes it's a suggestion, sometimes it's a recommendation, right? Sometimes you have a choice, sometimes you don't have a choice, right? So I think understanding where you have a choice and where you don't have a choice, where it's not like where it cannot be approved because it does not fall under the regulation. So that's important for you to, I think, understand. Follow-up tips. Okay, so this is very, very important. Like I can't emphasize this enough. If you get approval for a certain protocol, you have to follow that protocol to a T, right? So if you say I'm going to take the flyer example again, and I'm going to say, or let's change the example. Let's say you were enrolling participants from 18 to 50, and then you say, oh, I have a 51-year-old, I want to enroll this person. You cannot enroll that person. The only way you can enroll that person is if you change your IRB application and say, now you want to enroll up to 55 or 51, right? If you're using a certain kind of flyer, and now you decide, okay, I want to change the logo on my flyer. That's not the flyer that was approved, right? That usually has a stamp on it saying IRB approved so and so date, right? If you want to change the logo, please submit an IRB application. Sometimes it's like really simple. Let's say you found a spelling mistake. It's an administrative approval at that point. But if you're changing the entire selection, exclusion, inclusion criteria, that's a bigger thing, and you want to get IRB approval. So any change you want to make always goes through the IRB. Yeah.
Right. Now, that being said, one more question which I have is, what advice do you have for new researchers regarding IRB approvals?
New researchers, I would, if I were advising my new researcher self, this is what I would say: keep an open mind, right? There are many things we don't know, right? And that's okay, right? We are all learning, right? I've been in this field for some time, but I still feel I'm learning every single day, not just from researchers, but from my staff as well. So have that learning attitude, learning mentality, right? And try to like understand why certain things are asked. Like question. I'm not saying don't question, because that's how you learn. That's how many people learn. That's how I learn. But like, be open to suggestion and be open to recommendations and why you should do things a certain way. And I think that will make your life much more easier, right? And we are talking about like people who are experts in the field, right? Like on the IRB, if you look at people, even like the IRB staff that's reviewing your applications, or the reviewers, um, they are like looking at these applications for a very long time, right? They are well versed with regulations, policies, and procedures. So be open, and be willing to like learn. And then we discussed, I think, a bunch of strategies, right? Like for how to um, submit early, get in touch with people, right? Like how to refine your IRB application and your project, right? Um, yeah, those are the tips, advice I have for new researchers.
Wonderful. Thank you so much, Mahesh. That being said, now it's time for our short Q&A session. I know, Mahesh, thank you so much. You have been, providing valuable insight for our audiences throughout our webinar today. So this is the time for everyone to ask more questions so that, you can make use of Mahesh's time to the most. Now, Fani Madhav, we would definitely email you with the answer for your question. You asked, you wanted contact for the concern from QuestionPro team to have the IRB form, right, on QuestionPro. We would definitely share an answer for that over an email. Yeah? Wonderful, guys. If you don't have any more questions, just for everyone's information, right? We are living in the AI world. So we have an upcoming webinar on December 11, 2024. And this is going to be an AI debate, right? A debate on how AI is being used in all the universities and how it is affecting the universities. So if anyone likes to participate on this debate, please do email to edu@questionpro.com. And if any of you have more questions about today's webinar, you also can please email us to edu@questionpro.com. We would love to answer all your questions. And if possible, we would also get onto a call and we can explain that too.
Yeah, I would like to take this opportunity again, like to thank QuestionPro for this platform, right? I think it was wonderful in being here and answering a few questions and talking about like research compliance. If you ever need anything and need to reach out, feel free to reach out. My email is on our website, and I would be happy to answer any questions. Though I can't control what your IRB does, but I might be able to offer some helpful suggestions. So feel free to reach out.
Wonderful.
And thank you for the time.
So very much, Mahesh. Thank you so very much for spending your time, quality time with us, and providing so much information. This is going to be so much helpful for all our audience today, so that like Christy, there will be so many people. I know a few of them who kind of had to resubmit their application, but with today's insights, I know everyone will be able to get it done, get it right. Thank you so much, Mahesh.
Thank you. Thank you all.
Thank you all.
Bye.